Certainly the most common diagnosis that ultimately leads to a hip replacement is arthritis of the hip. But the arthritis of the hip, the worn out bearing surface that leads to the destruction of the joint and the pain and all the symptoms can be caused from a variety of different problems. Certainly the most common has been osteoarthritis. But as we become more sophisticated, certainly what I've seen in my career is now we understand what caused the osteoarthritis. And about 90% of the time, the osteoarthritis was actually caused because of some underlying biomechanical abnormality associated with the hip. Whether there was an impingement, whether there was overcoverage, whether there was undercoverage. And so if you're going to ultimately replace the joint, you have to understand what led to the biomechanical problem and correct it. Likewise, it could be trauma, it could be some sort of pediatric or juvenile problem that as we aged, the mechanics weren't right, it led to the destruction. Our knees often are associated with past trauma. We bang them up in high school or in our 20s, and then we get to be 50 and 60, and the cartilage is a perfect substance. It removes the friction, but it doesn't heal. It doesn't heal with hyaline cartilage, which is the type of cartilage that covers the ends of our long bones. And historically, why have people waited so long, and why has the trend really changed where people really aren't accepting pain and deformity like our fathers and like our grandfathers did? Some people clearly wait way too long. You don't need to wait until all your friends are saying, why are you limping, or you're miserable and depressed, or you're in a wheelchair. I think a lot of that came from the historic teaching. Certainly, even when I was a resident, we were taught, hey, this thing's going to last you 10 years. That's just not true. If this is done well, the hip, the partial knee, the knee, there's a tremendous probability it should last well more than 15 or 20 years, and hopefully a lot longer than that. I think invariably when someone has one joint replaced, when the other joint goes, and that's about 70% of the time, they just don't wait, because I'm a firm believer in this life being not a dress rehearsal, and every day really, really is a blessing. It's not just something you say, and if you're just miserable and unhappy and can't live your life, I don't mean in a destructive way, I mean in a constructive way, and a productive way, and in a responsible way, then I think we're blessed to be in this country with so many wonderfully smart people with resources, and I think you have to seek that out.